Every day, states across India publish an official death toll by COVID, but there are growing concerns that these numbers are wrong. But it's a gigantic task to count in a country of over 1 billion people, so here's what I've done. I tried looking at one aspect to get some sense of what the real numbers are. COVID cremations are being carried out in 29 crematoria and 6 burial grounds in the national capital, New Delhi. Out of these, 23 are crematoria and 6 are burial grounds. I've spent the last 3 days surveying them all. And here's what I found out. The state government of Delhi says that 3,049 people died of COVID in the 10 days between April 18th and the 27th. But my survey of 29 crematoria and burial grounds shows that they cremated a staggering 5,111 COVID patients from hospitals in the same period. That's 2,062 more deaths in only 10 days than the government's figures. Now, crucially, even this figure of 5,111 COVID deaths does not include people dying outside the hospitals. It also does not include people unofficially cremating their loved ones in the parking lots and in the parks. It also does not include suspected COVID deaths, that is, laboratory confirmed COVID patients who die outside the hospitals. What's more, I'm being told by crematoria and burial ground authorities, including Delhi's mayor, that the cremations of non-COVID patients has also gone up. The suspicion being that people are just not disclosing that the person they have brought in to cremate had COVID at some point of time because they don't want the delays and complications that come in with that kind of disclosure. Now, point to be noted is that these figures are just for India's capital, New Delhi, which has roughly 20 million residents, a small fraction in a country of over 1.3 billion people. That gives some sense of how grossly underreported India's data is. The city that we are talking about is still relatively transparent with its data, and despite that, there is a huge discrepancy that in a way tells us what kind of numbers would be in other Indian areas, particularly India's villages. All of this matters greatly, not just because there are elections in West Bengal which will be affected by these narratives, but also because these numbers, especially numbers of those dying, affect government's policy, public understanding of the disease, and what is the scale of deaths that come in by COVID, and also how much international support India might receive.